statewide committee on family support services today on December 10th, 2025. We're happy that you could join us. Those of you that braved the weather and came this way, thank you so much for being here. And thank you those of you that are safely tuning in from home. We appreciate you joining us as well. I'm going to turn things over to Kathy Nowak, co-chair, to do roll call and discuss terms.
Good morning. We're going to start with the roll call here in Albany. Tina Veal. Here. Mary McGuire-Weaver. Here. Dan Millett.
Here.
Crystal Vassler.
Here.
Mayor Bushinger.
Here.
And Gail and I are here as well. In Buffalo, do we have Karen Eschenseer?
Yes, I can see her. I am here.
Okay. Syracuse, Dawn O'Hara.
Present.
Long Island, Mary Fasano.
I'm here.
New York City, Deborah Greif.
I'm here. Good morning.
Good morning. And we have Ann Sheriff, who's home because of the impending bad weather, or she might have the bad weather already.
I'm here.
And Jan Fitzgerald, home for the same reason.
I'm here. Thank you.
They planned on being here today. And Scott Brady planned on being here today, but he's under the weather, and he will be joining us virtual.
I'm here, Kathy.
And I believe I see Aaliyah virtual.
Good morning. Present.
Okay. And I'm going to turn this over to Alexis, and you could introduce the OPW people here.
All right, good morning, everybody. So we'll do roll call in the room for OPWDD, and then we have, I think, maybe one person on virtually. I can see right now, Ari. So I'm Alexis Harrington. For those of you who don't know me, I'm one of the associate commissioners for service access and program implementation. Kick it over to the commissioner.
Good morning, everyone. Willow Bear, Commissioner of OPWDD.
Good morning, Chad Colarusso, Director of Family Supports within Service Access Program Implementation.
Good morning, everyone. Nick Hobson, FSS Statewide Coordinator.
Good morning, Amy Burdick, FSS Statewide Coordinator, Assistant Statewide Coordinator, excuse me.
Good morning, Michelle Torres, Long Island Regional Field Office Director.
Good morning, everyone. Abiba Kindo, Deputy Commissioner for Service Access, Program Implementation, and Stakeholder Support.
Good morning, this is James Doherty. I'm the Director for the New York City Regional Field Office.
Good morning. This is not working. Good morning, can you hear me? Hold it.
It'll be a red light when it's ready.
Good morning. Good morning. I'm Delia Tucker, Statewide Director for Service Access Program Implementation and Stakeholder Supports.
Good morning. I'm Anne-Marie Peterson, Associate Commissioner with SPS.
And then virtually, it looks like we have Ari and Kevin on, if you guys want to introduce yourselves.
Sure. My name is Ari Maceo. I am the Deputy Counsel for Privacy Policy, Regs, and Ethics here at OPWDD.
And I'm Kevin Valencius. I'm Deputy Commissioner for the Division of Fiscal Policy and Management, and I'm joined by Craig Rogers, who is also online, Director of our Budget Services team.
Thank you. And it looks like Eileen also joined us, and John. Eileen and John, do you want to introduce yourself?
Hi, I'm Eileen Haynes. I'm the General Counsel.
Hi, this is John Barbuto. Sorry for the camera. I'm struggling a bit here today. Executive Deputy Commissioner, OPWDD.
And you also have Josh Olson. I'm the Deputy General Counsel.
Thanks, everybody. That's it for OPWDD, though we do have additional folks who are helping us run the meeting. All right, so,
You know what, I'll go first.
okay.
So we're going to just announce the terms. There were 5 people who were ready to move on and have a person replace them as a statewide representative. Their local councils voted them back in for another 3-year term for a number of our current members. We have Ann Scherf, who was voted back in. We have Mary Fasano, Tina Vale, and Deborah Greif. And we are so happy we have you. You did wonderful years of work, and we look forward to working with you with the next 3 years. Maria Suchi-Zozak from Hudson has turned and retired, and now we have Dan, who we introduced earlier, Dan Millett, as her replacement. And we look forward to working with you, Dan. And then we have Chris Palega, who was a member from Monroe, who has decided to resign. We're waiting for his replacement, and we wish Chris all the best. He did wonderful work in many, many areas, as well as the other members that are going or have been renewed for another 3 years. Thank you all.
So now it's over to the commission.
All right, and everyone's looking at me.
Yeah, if we can
That's
just
my turn.
move the next slide, we'll do commissioners' updates.
Well, good morning, everyone. I'm excited to be here. I was really sad to have missed the last couple of statewide meetings with scheduling conflicts. So I had today's meeting with all kinds of notes on my calendar that nobody was allowed to schedule over it. So I'm really glad to be able to be here and to sort of dive back into the world of FSS. As we are really publicly starting to talk about the next stage of our service system and the need for a new 5-year strategic plan, FSS just continues to occur to me as a really important way that we support people in the community without needing to move people into the waiver, and I really want to lean into that over the next couple of years as we work through our strategic plan. So I'm excited to be here. Thank you to Chris for his years of service, and to the 4 of you that were just renewed for another 3 years. We really appreciate that. I know that while I missed the last couple of meetings, you guys were in great hands and updated by my team. A few things have happened since the last time we all got together, or you all got together, that I just wanted to make sure I highlighted for awareness. So the first is the Commissioner's Task Force on Aging was officially launched. I can't recall whether we talked about that in this group or not, but it is a time-limited subcommittee of our DDAC. Assembled specifically to talk about aging in the context of the IDD service system and how we can do better to meet the needs of an aging population. You've probably heard me say that we are in the midlife crisis of the IDD service system, right? 50 years ago, we moved everyone out of institutions and did a very good job. And now 50 years later, we have people living a lot longer than anticipated at that time, which is a wonderful problem to have. But as a system, I think we're not quite prepared to meet the need of people as they age. So the governor invested in the Master Plan on Aging last year, which was headed by the state's Department of Aging and the Department of Health. A lot of good recommendations in that report about aging in New York generally, but the Task Force on Aging will really focus on the IDD system specifically and come up with some recommendations about how we can better support physical plant of the places where people are trying to age in place, how we can provide some more meaningful day activities to a retirement-aged IDD population, things like that. So excited to have formally kicked that off and expect some recommendations out of that group, hopefully by the end of 2026. I'm looking at my friends to see if that's too ambitious, but that is the goal. The second thing that has happened since we last met is a release of our Regional Disability Health Clinic RFP. So you might recall in last year's State of the State, the governor invested $25 million for OPWDD to give out in grants to existing Article 16 and Article 28 clinic providers. Those providers applied to us for those funds and had to tell us how they would use money to expand access to healthcare, specifically for people with developmental disabilities. So it's things like building sensory rooms, buying accessible equipment, expanding an existing dental clinic to serve more people in that region of the state. So we received a really impressive number of applications from existing healthcare clinics, and we will be awarding those funds early next year. So really excited to tell you more about that at the next meeting. Our self-direction evaluation has also been released since the last time we got together. So you probably know that we engaged about 9,000 people and families, some most using self-direction, some seeking to use self-direction, to really understand people's experience within self-direction, to develop a set of recommendations for the agency about how we might better the model, how we might make it more sustainable into the future. So that report has been released. It's on the website. There's a plain language version. There were sort of 8 thematic recommendations with 32 specific activities that Guidehouse has recommended that we engage in. Some of those are short-term goals, some are long-term. So we're in the process now of really diving into those recommendations, engaging interest holders in terms of what would have the biggest impact, what might be a long-range plan as part of a waiver amendment, things like that. But a lot of good material in that report to dig into if you are interested in self-direction, and that is available on our website. Fourth update in terms of strategic planning, I think most of you probably participated in one or more of our strategic planning forums over the summer. We once again did sort of a roadshow around the state in different regions, different areas of the state. We did a couple of online virtual forums for people who could not make it in person. We held one entirely in Spanish, one in Chinese, one specifically for self-advocates. So really just making sure that we're reaching as many communities and interest groups as possible. So our strategic plan update will be released hopefully by the end of this calendar year. And then we will immediately start working on our next 5-year strategic plan. So I'm excited to sit in this role to be the commissioner as we really lay out sort of the next big transition and vision and transformation for the system. So we're going to do a ton of work and engagement on that over the next couple of years. So certainly look for more of that. I imagine that plan will very heavily focus on the 3 sort of themes that you've probably heard me mention over and over. One is accessibility of the service system, and by that I sort of mean the customer service forward vision of the agency. So making sure that people who use services, families who rely on services, and providers of services are all able to experience the OPWDD system in a positive way that's the most efficient and sort of customer focus as possible. So that's sort of one big theme that I think you can see in conversations coming up in our next 5-year strategic plan. We also want to make sure that services are effective, sort of the second theme, that they are meeting the needs of people now. We know that the sort of best models of care are continually evolving, and so looking at employment, for example, are we making it as easy and successful as possible for people to be engaged in meaningful employment? So sort of that outcome focus of the service system. And then the third real theme is our system sustainable and equitable as it's designed now, and what can we do to make sure that it is? So excited to dive into all of that work. It's a big job for us, and excited to do it. Our website, I think, is something else I just want to draw some attention to. In that customer service focused vein that I was just talking about, we're doing a lot of work to make sure that our website is as accessible as possible, that if you're looking for information, you can find it, that information is presented in a way that's readable and understandable and comprehensive. So we, for example, have updated the employment page on the website. That was done in collaboration with our DDAC Employment Subcommittee, had a number of really good recommendations and created some material for us. So that was one of the first steps on our website transformation. We also updated our family advocacy page. And by updated, I think we actually created. I'm not sure it was there before. So created an entire page on the website specifically for family members to come understand what services are available, what those look like, how to access them, some very high-level material, links to all of the different parent and family advocacy organizations that exist across the state, just to try to put everything in one place as a starting place for families. So that, I think, is live, or it will be live this week on our website. We also are working on a housing page. I think that came out of recommendations from maybe this group and the DDAC as well, larger DDAC, in terms of having information available about all of the continuum of housing and residential options that are available throughout the OPWDD service system, so you can understand the difference, how some of the eligibility criteria might look a little different. Some are meant to be transitional, right? Just a really easy to use guide to understand what housing and residential services are in the context of our service system. So that's the place that we're focused now in terms of website updates. So just a lot of really good work going on since we were last here. And again, I'm excited to join you. So thanks for having me.
Thank you so much, Commissioner Bayer. Next on our agenda, actually, I'm going to pause here, and we're going to see if there are any questions about that content that the Commissioner just shared with us, and we'll start with those here in the room. Are there any questions? Okay. How about out in Metro? Any questions? Syracuse? Questions?
No.
Thank you. Let's check in with Buffalo.
No questions.
Okay, thank you. And Long Island?
We're good.
All right. And any of our other members joining us virtually? Any questions?
No, thank you. Okay.
This is Ann. I was just wondering, with the aging task force, are you looking at within the, as far as having the, are they looking at having the agencies come on board to enable support aging in place, and maybe also working in conjunction with the Office of the Aging?
Yeah, thanks, Ann. I should have specified. So the task force was assembled with self-advocates, family advocates, healthcare experts, aging experts, experts in the field of IDD. We have someone from the State Office of Aging who is a task force member, and Department of Health is represented, I think. So the task force will meet with different groups on different topics as they go through their work, and one of those topical areas will be inviting providers who do a lot of really good work already in the space of aging in place, who can come and sort of share their experiences and expertise with the task force to help come up with some recommendations. So that's absolutely part of it.
Thank you.
Okay, if there are no other questions for the Commissioner, we will move on to our next topic, which is our Council's update, and I believe delivering that today is Ari.
Yes, thank you so much. I appreciate it. Hi, everyone. I just have a quick update. Last meeting, it was brought to our attention that members were interested in doing a HIPAA training to make sure everyone is complying with HIPAA requirements. So we are working on that. We are planning on getting a training on the schedule for the first part of the new year. We just want to make sure that we have someone knowledgeable in HIPAA to present that for you guys, just in case there are any questions. So we are hoping to have that scheduled in the first few months of the new year.
Okay. Is that it, Ari?
That is all I have for today.
That is short and sweet. Okay, thank you so much. We look forward to that training and getting that information, so thank you for coordinating that. Next on our agenda are OPWDD updates, and I will hand it over to Alexis Harrington to start that off.
Thank you. So you're going to hear from a diverse group of voices today. We've decided to divvy it up. So I'm first, and then I'll throw it over to Chad. So our first update for you on the request for proposals. I think you all know that we are still in the restricted period until the contracts are fully executed. We are not at liberty to discuss details, though you all will know when those contracts become fully executed. So nothing that we can share at this point. So then I will turn it over to Chad to cover background on the site visit guidance.
Can I just ask approximately when they think that will happen? Everybody in the council asked me that.
Yeah, Alexis, I can respond to that. We hope to issue tentative awards by the end of the year.
Thank you.
Alexis, I know there was a question from one of our members. Will you notify us the day that the awards begin so that the councils know?
I think we'll have to bring that back because I'm not sure if we'll be able to
Not
just
prior, but the day it's
like just a heads up that awards are going out.
that it went out.
Yeah, absolutely. We can do that.
Thank you.
Yeah. All right. Go for it, Chad.
Okay, thank you. Advance the slide to the next one, please. So we're happy to share that it's been a year of work to complete a statewide FSS site visit guidance document. Want to really express appreciation for everybody on the committee who provided feedback and let you know we did utilize that and incorporate that feedback into the finalized document. This was something that we really wanted to get out for consistency and clarity around the evaluation portion, specifically to site-based programs, especially after the pandemic, when a variety of forms and frequencies and flexibilities were utilized to adapt and accommodate. So now that we're in a place, post that, we want to make sure we have a consistent process being used across the state. So the new guidance document was shared earlier this week, both with the OPWDD Regional Field Office leadership and FSS teams, as well as the FSS committee members here. It has a December date, and the idea is that it can be used for reviews going forward and would line up with annual schedules starting in 2026. Want to note that this guidance is specific to the visit aspect for state site-based programs, which is part of the comprehensive FSS program evaluations and that evaluation checklist. The evaluation checklist is not changing at this time. The site-specific items on the checklist can continue to be used. I won't go through the entire 4-page document, but want to share a couple of the key highlights therein. One of the things it specifies is that site visits need to occur at least annually for site-based programs. Those visits can coincide with comprehensive annual reviews, but they can also take place at a separate time. Also at regional field office discretion, visits can be more frequent than annual. The document details the allowable formats for the visits, which includes options for remote and hybrid in-person remote options. It pushes that the best practice is for visits to be in person, and also a standard that the majority of site-based programs in a region need to be visited in person each year. But again, it provides flexibility for some visits to be remote. It expresses that where a site is visited remotely, that's not happening exclusively year after year, so that there's a rotation at least once every 3 years of sites getting visited in person. And I do want to emphasize that the baseline requirements in the document are really specific to the RFO staff. So there's more flexibility really for local advisory local committee members who are able to participate in the visits. So again, the guidance notes that local council members are strongly encouraged to participate, should be given advance notice of when visits are going to happen, and that efforts should be made to ensure that local council members can attend. but it's viable for the local council members to attend remotely while an RFO staff person is there in person. So again, it's just trying to be accommodating, give that flexibility, really ensuring that there's an opportunity for local council members to be involved. There's also some language in the new guidance document that speaks to conflicts of interest specific to site visits, specifically that council members with a conflict of interest must not participate in those site visits. In a few minutes, we're going to go through some examples that the committee shared, real-life examples, so I'm not going to detail those here. That's going to be the next segment. But that will give some good examples of what may or may not constitute a conflict of interest. And just the last piece I want to touch on is that comprehensive program evaluation checklist. Again, as I noted, that's not changing at this time. However, we have noted that that's something that is really next in line to be updated. So we plan to really be diving into that in 2026. And of course, we'll be working collaboratively with committee members to get feedback and incorporate it. And that'll be a project for next year. Thank you.
Does anybody have any questions in the room here? Anybody in Buffalo have questions? Long Island?
Yeah, I have a question. The surveys that have been bandied back and forth, and we thought we had a statewide survey. On Long Island, we've had some difficulty in getting things back. And the question was raised, could we adapt our surveys to use that Survey Monkey, which is it's very user-friendly? Can there be any consideration given to this kind of procedure? Don't everybody answer at once.
Sorry, I'm just trying to understand, is the question if we can use SurveyMonkey for those family satisfaction surveys or use that as a tool towards the site
Yes,
visit?
so the family satisfaction, yes.
We don't prescribe the method in which folks issue the survey, right? I think we just wanted to make sure that we had certain criteria to get specific satisfaction understanding back from participants and families.
So if we're able to adapt the accepted survey used statewide into this Survey Monkey, that seems to me you're saying we could do it.
Mary, I can tell you that Region 2 has adapted things, and we do hybrid, both electronic surveys and some paper to make sure that we're accessing everybody.
Right.
That is doable, but we do have to make sure that the platform that's selected is HIPAA compliant and protecting people's private information. So you may want to work with your local council and RFO on that, but that is doable.
Are you able to
Okay,
share
so
that?
they could get in touch with your folks too, right? See how you did it?
Yep, Region 2 is doing it now. So we have some great folks in Region 2, RFO, I'm sure that would have some information to help guide you, yes.
All right, thank you.
Gail, are you able to share that with us, what you're using?
I would have to look into it and get back to you because I am not the technical expert on my local team, but I can absolutely ask them what platform they're using and let you know, yes.
Okay, thank you, I appreciate it.
No problem.
Does anybody have, hold on 1 minute.
And Gail, I think I remember when you guys were developing it, there was a component that if it was that you had to collect, if there was like an incident that was reported in the survey. So I just want to make sure when you're sharing that that's covered, because that was another component in addition to the HIPAA compliance. Because sometimes that happens when they come in, someone reports something.
All of the responses go directly to the local, the RFO, I guess we call them now, sorry, I'm still DDRO language, but The council does not get them directly. We get probably what are edited versions, if there are things in there that are too sensitive in nature, that the council wouldn't necessarily get that detail. But they do get a version of it, so they can see how the local agencies are doing with their programs.
Any questions for Metro?
Yes, hi. How many days in advance should the advisory councils be notified about site visits?
That's a good question. The guidance does not specify a specific number of days, but certainly something we can look at setting a best practice around. Right now the main point is giving kind of reasonable advance notice.
I have one more question. The other question is that when it's sent to us, sometimes we get I know the agency's name, but we have a hard time getting on. We try on more than one, either computers and smartphones to get the exact date and time. Is there any specific guidance that OPWDD has that how we are supposed to be notified, the advisory councils?
The mode of notification wasn't notified, but I think it speaks to, the importance of having that ongoing relationship with the local FSS team, and if there's methods that aren't working, if email is problematic, certainly letting them know, or if that's problematic, letting us know. You can let us, through the mailbox or through the statewide representative here, and so the RFOs can know what the best way to reach people is, whether it's telephonic versus email or otherwise.
Thank you. I'd rather talk offline. Thank you.
And do we have any questions from Ann or Jan or Scott or Leah?
I have a question. Can you hear me?
Yes.
Oh, great. So, Gail, I just want to follow up with what you said about the surveys. Was the change in how you collected done by the regional field office, or was that a council-driven change?
It was a collaboration between the council and the field office. We came up with and proposed the idea, and our field office supported it several years back, actually. And we worked on it together because we can't own the data. It has to be OPWDD's data. But we had amazing experts that worked side by side with them to kind of come up with a whole bunch of, we tailored different surveys. Of course, we had to change those when the new ones came out, but we have adapted. So it was a collaboration between both the RFO and the council members together.
Great idea. And just one clarification, Chad, so the checklist, so I've never done a review yet. I never physically went on site to do one. I participated, but didn't have a lot of information, water under the bridge. This guidance is great. The checklist is for the regional people to use, and we're allowed to come up with our own questions or whatever moves us at the time of the review to ask questions. Is that correct?
Yeah, that's correct, Scott. So the checklist is completed by the regional field office. Again, it's an annual evaluation. It's comprehensive. That includes site-based elements specifically for those site-based programs, but it needs to be completed for every program. And right, the idea is you're having the local council members able to attend and ask questions and get a sense of things as well. We haven't prescribed a list of questions or a checklist for local council members.
Oh, so there are questions that you want us to ask? We don't want to go outside that?
Sorry, no, we have not prescribed those.
Oh, okay. Very good. Thank you.
And I'm going to come back into the room. May has a question.
Yes. Can you hear me? Is it working? No.
Yes.
A little bit.
Okay, so my first question was answered. I was thinking to ask who is on top of this survey. So based on my understanding is that the surveys are, that the regional field is on top first on the surveys, right? It's not something from the local advisory council is issuing the survey, it's the regional field office.
Correct. So for the site visit guidance, that is all being driven out of the regional field office as lead, but partnering with the local council members who can attend the site visit.
Right, I'm talking about the survey, the satisfaction survey.
Yeah, the satisfaction surveys are required for the providers to complete because it's connected to that FSS family reimbursement ADM. So it's the responsibility of the provider, but I think what Gail was talking about is that a collaboration kind of came out of that between her agency and the regional field office. So in terms of who's responsible, it's the provider, but there have been some really great examples of collaboration between the field office and the FSS providers.
Right, so the providers are responsible to fill out that survey, but
To send it out.
to
They're responsible to send it out.
send it to OPWDD.
To send it to families that they serve.
Okay, so they
To
are
send it to
sending-
families they serve, sorry.
Okay, and the families, I guess, are filling it out, and it's getting back to the providers?
Some families fill it out, yes. The response rate isn't terribly wonderful, but neither was paper. So it's slightly better. Electronic survey responses are slightly better than paper. So, but they're sent out by the providers to the people that they serve in the previous year, and then all of the responses are sent directly to the DDRO, and then they compile all of the paper and electronic surveys depending on what method was used, and they share most of those results. They're just nothing too super sensitive if something like that is included, but they share those overall results with the local councils so that each of us know how local programs are performing and how families feel they are performing.
Is there any time in the year when the surveys are being sent, or how does it work, the system of issuing the survey?
You guys developed the whole survey together, right? The council members with the regional field office, so every provider got the same questions, right?
The new version, every provider, yes. The new version is standardized.
Yes.
So Anne Marie just asked if we use the standardized questions that were developed by the council and OPWDD released not that long ago. We use those, and so that's included in the electronic survey, and then we send paper to those that don't have email addresses. So, yes. Crystal?
How do we get access to a survey, or do we create it ourselves, or how do we?
It's something that you work with the DDRO to create. Again, the DDRO has to be the lead. They have to have the username and password for whatever platform is used, because we as council members can't own that data. So it has to be that's why it has to be led by OPWDD with a collaboration with the local family support council.
Okay, do they already have one that they use right now, or?
I don't know what other regions have, but I'm going to try to find out what Region 2 uses and share that information with our local council members so you can take it back to your RFOs and maybe recreate that collaboration.
Okay, thank you. I really appreciate it.
Yeah.
And Gail, there is one available, I believe, on our website that was updated in 2022, so I'm not sure if folks have seen that, but there is a paper version that is on our website from 2022.
I actually have a question. Chad, I think what I heard from you is that during the annual review or the site visit, that it really depends on the availability and the scheduling, and then whatever the notice that's given to the local council member, if they could join face-to-face. But you mentioned something that, like, you'd like to make it flexible and that could be hybrid. What is, in reality, does that mean? That, does the DDRO go out to the site and then hook up with the local council members via phone or?
Exactly. So the language we included in the guidance is that whenever possible, at least one local council member should be included in the visit, but we wanted to have that flexibility, so that's where the hybrid option, as you just described. So if local council member wanted to attend but couldn't travel for it, that hybrid option of the RFO staff being there and linked up via a video call or otherwise, so the local council member could attend is an option. Again, in person, always the best practice, but we just wanted to make that available for flexibility purposes.
So you're going to make sure that all the DDROs have access to a computer or something, a laptop? I mean, that's what I'm saying. How's this really going to work?
It's a good question. If, I think that's something we'd have to look at equipment-wise. There are, the ability to do that with OPWD issued phones, laptops. So, I think we could, I think trying to do that in advance is going to be the best practice, making those arrangements. Again, that active communication is critical. So if there is a need to do that, might be tough to do last minute if the RFO staff doesn't have that equipment. But I think with notice, it's something we plan to accommodate.
Thank you.
All right, so if there are no further questions on that, we will flip it over to Ari to respond to the conflict of interest questions that the committee had.
Hello again, everyone. So before I get into the actual questions, I just kind of want to lay out what OPWDD believes is a conflict going into these questions. So we have found that there's a conflict of interest or an appearance of a conflict of interest if a person going on a site visit is either an employee of the provider or a member of the provider's board. However, since the regional field offices rely on parents' views of the program, we don't believe it is a conflict if the person has a conflict of interest or the appearance of a conflict of interest if the person has a child in the program being reviewed or participates in a program a different program under the same provider. So with that in mind, I'll go through these questions that have been raised. So the first is, can an FSS council member who is a board member of an agency that is being reviewed participate in a site visit? I think that's kind of clear. We're saying no, that we believe that would be either a conflict or would present the appearance of a conflict of interest, and we'd like to try to avoid that. So the next question, it's a little more complicated. In this instance, when an FSS council member is the parent of a child enrolled in one of the FSS provider agencies programs, that is not the FSS program being reviewed. So that's saying that it's separately run by the same provider. Does that preclude the member from participating in that site visit? And we believe that it does not automatically prohibit that. We think that as part of OPWDD's review of the program, the regional field office representatives need the person's feedback from the parents or someone in the program. So in such cases, the person may attend the site visit. However, the person may not make decisions as to whether the provider is compliant in the FSS program. Those decisions are entirely within the discretion of the OPWDD representative. Next slide, if you don't mind. So then the next question that was raised, the next instance, is what if the child is attending the program being reviewed? And again, we think that's a little more complicated, so there's more that goes into that. So that is not necessarily them being prohibited from the visit as part of OPWDD's review of the program. As I said, the regional field office representative may be looking for feedback from parents of a person in the program. And so, as I said, in those cases, they may attend the site visit, but again, decisions of compliance are completely within the discretion of the OPWDD representative. Then the next instance is what if the child attends a different FSS program at the same agency, but that is not the one being reviewed? We believe that that is likely not a conflict, but it definitely depends on the circumstances. A conflict or the appearance of one can likely be avoided if the council representative is not empowered to make the decisions, as in they are just there to observe. But again, how this feedback is going to be influential in decisions, then a conflict would exist, and we would ask them to exclude themselves from that instance. Next slide. So again, a little more clear in this one. If an FSS council member is an employee of the provider agency, can they participate in the site visit? Because of their direct relationship, we believe that would either be a direct conflict or would absolutely give the appearance of a conflict talking on their employer's record. So we would ask them to exclude themselves. The next one, what if the employment is in another area of the agency unrelated to the FSS program? We believe that this would also be a conflict of interest given the proximity. And then obviously, if the employment is directly related to the FSS program, that would very clearly, in our opinion, be a conflict of interest given the proximity of the member to the program. And I believe those are all of the instances that were sent to us about these site visits. If there are any questions, I'd be happy to go through them.
Does anybody have a
just
question?
comment. Yes, yes, but it's not a question. It's just like I wanted to say, like when Ari, you said that a parent visits as a site visit for the I mean to survey that and already you know, her child or is in the program. I think it's a conflict of interest. Why? Because we don't want to reference or comments from a parent as a parent. We are going there as an observant with the DDRO representative. So the issue comes up as to what the status of that parent is going to be. So just to be not playing with the fire and causing conflict of interest, because we have to remember that the agency also can say that, you know, we are uncomfortable because this mom has an issue, you know. So rather than doing that, we should have other family members who are members of the council, and we should offer them at the site. But that's just my way of looking at the site visits. Plus, I'm really happy that we are going to have HIPAA training, but also I would recommend, and it's not necessary that you would agree with me, but I think we should have praise also. So Chad would know that we all, as support brokers, we do every year's praise, and praise is very important for anyone who deals with special needs population. Thank you, Ari. Very informative.
Thanks, Aaliyah. In just a quick response to your comment about your opinion of it presenting as a conflict, I think it's really up to the local council in terms of who is available for that particular site visit. I think, you know, in your part of the state, there are a bit more people to choose from, and then in other parts of the state, there are limited pools of people to choose from. So totally understand your point. We are just presenting the baseline and council's position on what presents as a conflict, understanding the critical importance of ensuring that there is family representation at these site visits.
So while we're in virtual land,
thank you, Alexis. Thank you. But my comment is just for the sake of looking at both the sides. That's fine. Thank you. From the agency point of view as well. Thank you.
I see Dawn's hand raised.
Thank you, Kathy. So I'd just like to, I have a different reaction to this. I'd like to read the guidance that I got yesterday. So this says, therefore, council members must not participate in council discussions, votes, or attend an official site meeting in their capacity as a council member that is related to any organizational, familial situation, or agency in which they or a relative have a financial, contractual, or personal interest or affiliation. That sounds pretty clear to me that this says, so number one, if you have an affiliation, if you have an employment with the agency, that, and correct me if I'm wrong, that you can come to the site visit on behalf of the agency, but not as a council person. That would make a lot of sense. However, I think it was Alexa that was just talking about, we're in a very rural area. You've pretty much negated we have 6 council members in an 8-county region with multiple agencies in our area. You've pretty much negated most of our council members from coming to any site visits based on how this is written in that 1-sentence paragraph. Am I right or am I wrong?
Could you rephrase that for me? Are we saying
Okay, so I'm reading what I got yesterday, okay, and it says, council members must not participate in council discussions, votes, or attend an official site visit in their capacity as a council member that is related to any organization, familial situation, or agency in which they or a relative have a financial, contractual, or personal interest or affiliation.
I 100% agree. I think that what we are trying to do here is allow for the regional field offices to get input from family members while not making the determination themselves, while still leaving it up to OPWDD, but not excluding their insight into the familial relationship, because the regional field offices do rely on that point of view. Whereas if it is a individual who works for the provider, we feel as though that is more of a direct conflict. You are there giving information about your employer, so we think it gets a little more muddying of the waters and conflicting. If I'm not answering your question, I would be happy to talk to you more offline about this. But I think that we're trying to balance the having a conflict, having an interested party involved, and also not excluding individuals where we feel their input is important and we need to take it, but also allowing OPWDD to have the final say in their discretion.
And I understand the content and the context. I guess my suggestion would be that maybe this needs to be a little more expanded. I don't see anything in here that this is at the discretion of the regional offices. This is a pretty clear-cut statement, and it's a 1-sentence statement for a pretty big issue. That would be my observation.
We appreciate that.
Dawn, what were you reading from?
I got an email yesterday. It's the 4-page guidance. I'm guessing I'm reading what was submitted and put out yesterday.
Oh, the site visit guidance?
Site visit guidance.
Gotcha, okay.
Okay.
This is Long Island. I totally agree with what you just said, Dawn, because even though I'm not in a rural area, we have 6 people on our council too. And, I think, it's wonderful to have these guidelines, but do any of these people live in our real world? Where are we going to get all the people to do this? If we're just going to nitpick, and if the value of the council is to get the input from families, there are only so many of us who are willing to do this work. It's very frustrating.
Thanks for raising that. So it sounds like there's an understanding on the specific questions that were posed by the council, and there's a feeling that there's a misalignment between what we have stated in the presentation compared to what is in the actual site visit guidance. So that's something that we'll take back. I don't know, Biba, if you want to.
I think I'm also hearing differing opinions from some of the council members as well, right? Like Aaliyah's statement is in conflict with what Dawn is stating, right? And I think we're not going to have a perfect response, but what we were trying to do was to strike a balance, right? Identifying what we believe is a direct conflict, but also recognizing the point that Mary and others have raised. We know that certain council members, given the dynamic of that local council, there might be very few membership, and that those members may be affiliated with a specific FSS provider program. And so that's why that caveat was given around being able to attend and observe, but that the decision-making and authority resides with the FSS coordinator who is on site. And so I don't want it to be lost that what we're doing here is addressing both points and striking that balance. We're not dictating that it absolutely cannot happen, but we're specifying that where it needs to happen because of the membership of the council, that the FSS coordinator is the authority in that capacity. And I hope that makes sense to folks.
I agree. I think we have to bring this back and match that slide to page 3 of the actual guidelines that we received yesterday. Okay, Crystal has a question? You got to get...
Oh, it's not on? Oh, it looks like it is. My question was just to see if the guidelines would be updated with this information added into it, since there is that conflict. I didn't know which one would be updated.
Are you asking if some of this specific stuff would be included as like an FAQ or an addendum to the site visit guidance, or included?
Yeah,
in the
an
guidance?
addendum, because what was just read off to us, this here conflicts with what's in there. So I was
Right.
wondering if this would be updated. This would be the updated version to the guidelines that were sent to us yesterday.
Yes, but we just need to take that back and reconcile the differences. But our position as an agency is what you're seeing on the deck, because we understand all the things that you said about having limited pools of people. So the bottom line is it's critically important to ensure a family voice is part of these visits. So
Okay,
we will
thank you.
update accordingly. Yep.
Okay, I appreciate it. Thank you.
Yep. We can go to the next one.
Good morning. Everyone hear me okay? So just have a couple of updates from the September meeting. In particular, we have updates around the informational materials, which are the various brochures that I'm sure everyone's heard me speak about several times. First up is what I refer to as the OPWDD FS brochure. Once again, that's the brochure that is on the OPWDD website that we updated a couple years ago. We heard from committee members that there were some other language changes that needed to be done. After some back and forth with those, we have made those final language changes, and they have been added to the updated version of that brochure. At this time, we are just awaiting posting on the OPWDD website with that new updated brochure, and there will also be all of the translated versions. So that once, as with all things, once that is publicly available, we will make sure to get that link out to everyone. The other brochure, which I refer to as the statewide committee FSS brochure, this is the brochure that all of you are awaiting actual copies of so that you can distribute them and use them in recruitment efforts. The purchase order has been placed, or shouldn't placed, it's in process by OPWDD Central Office. So at this point, we're very close to finally getting everyone copies of that for the councils that requested those. So I don't have an exact date on that right now, but once again, once we know, it will be coming to you, and then you will be able to use them in recruitment efforts and providing people and families in the communities with additional information about FSS. Last piece.
Nick, could I piggyback on that just for a quick second?
Yes.
And I'm not calling anyone out, but we have a few council member, statewide council members that I have emailed and requested a mailing address for their brochures and to confirm those numbers. If you have not responded to me, if you could, that would be wonderful. Just want to wrap that up and get that sent back to Central so they can get this on the current year budget. So, thank you. Sorry, Nick, thank you.
Oh, thanks, Gail. We appreciate it. Last piece on this slide, the FSS statewide bylaws, they have been posted to the OPWDD website. We're gonna put the link, I don't know if Amy's done that, in the chat that you're in, but we'll also get that out other ways. It's on the OPWDD webpage, there is a FSS statewide committee page that has all the members listed and some other information. That's where the bylaws can be found now, and they are current and up to date. Next slide, please. And then the other last update, just to follow up from public comment from the September meeting. We, as always, it's a, we're looking to collaborate with everyone to get people's feedback. That's been a part of the meeting as long as I've been doing this. All the comments that we received in September were reviewed. There weren't any items that required additional follow-up from OPWD divisions or the regional field offices. We didn't identify any specific trends. One thing, though, that is upcoming at this meeting is there were comments from our peer support specialists out there, and following our break, they are going to be doing a presentation for all of you. So those were all the updates I had from the previous meeting.
Does anybody have questions in the room? Crystal?
I was just wondering if, for the brochures, when they're mailed, will that be paid by OPWDD, or do we need to calculate that cost from our $3,000?
That amount will come out of each local council that ordered brochures of $3,000.
The shipping cost will?
Yes.
Okay.
Yes.
How will we know, or when will we know?
I have a few people that still need to send me their information, and then we'll have like the big picture, and I'm sure that will help be able to finalize numbers.
Will that come out of this year's 3,000 or next year's 3,000?
That was the goal, but
Yeah.
we need some more information from some people, and I know Nick is doing his best to push that through this year, but we need everybody's help to
Okay.
get there.
All right, thank you.
Thanks.
Any questions from Buffalo? Long Island? Metro? Jan, Aaliyah, Scott? Okay. All
Yeah,
right.
I just have a quick comment, Kathy.
Mhm.
So I agree with, I was going to ask the same question that Dawn asked about the 3,000, what year it's coming out of. I mean, since we really had a late start this year with being able to spend the 3,000, it would be great if we could get the money encumbered in this fiscal year rather than next year. That's possible. And, you know, for folks that didn't respond, I hope I'm not one of them, because I think I did respond.
I got you, Scott, you're good.
You never know. It shouldn't hold back everybody's expenditure of the $3,000. There should be a way to just say, okay, they didn't respond, let's get the whole thing moving. And when they are able to respond, get them their brochures. I don't, you know, we shouldn't all be held up because of a few folks, my opinion.
Well, it seems like we could wrap up a little early for break, and we'll be back. What time? 12:45? 12:45, and that's when we'll hear from the Peer Support Unit overview. Thank you.
All right, we are going to get back into our meeting. So thank you, everybody, for coming back on time. Next on our agenda, we're going to have a presentation from some peer specialists. So we're going to, Advocacy and Peer Support Unit overview, we're going to turn it over to the Office of Advocacy and the peer specialists now. So.
Unmute her. Chris. You ready, Chris? Hello, everyone. Can you hear me?
We sure can.
Wonderful. Chris, are you doing the slides? No, they are. Okay, so I just want to confirm, right? Okay, I have somebody do the slides and everything.
Yep. Just let us know when you want us to advance, Christopher.
Let's start at the cover page, please. The one that's. Hello, everyone. As Alexis said, I'm a peer specialist with the Advocacy and Peer Support Unit, Office of Advocacy, here at OPWDD. I am joined by a colleague of mine, BJ Stasio, who is a peer specialist too, as well as the director of the unit, Lisa Saleme. We are going to be speaking about the unit, the role that we have, and providing some general information on how we support how we support people, and how you folks can as well. Next slide, please. Our Office of Advocacy falls under the Commissioner's Office. We work very closely with the Commissioner herself. We have two main domains within our unit. One, the Advocacy and Peer Support Unit. And if you folks see me looking down, it's because I'm looking at the slides on my computer as well. And we also have the Ombuds Program collaboration, which the Office of Advocacy collaborates with the Independent Developmental Disabilities Ombudsman Program. The Advocacy and Peer Support Unit encompasses a team of advocates, which is what my role falls under. We educate, advocate, and improve, which we are going to be going more into in a few moments. Next slide, please. A mission statement that our unit created is as follows. We amplify the voices of the disability community by providing education, advocacy, and peer support while protecting rights, providing OPWDD navigation, and promoting inclusion. Today, we are going to be going over the Advocacy and Peer Support Unit. Next slide, please.
Move it on. Yeah. There you go.
The Advocacy and Peer Support Unit, as I stated, is a unit under the Office of Advocacy. Our unit has 4 peer specialists, myself included, 1 peer specialist 2, who is BJ Stasio, who is joined with us, as well as a client and family advocate. I am based in the Staten Island metro region. BJ Stasio is in the Buffalo area. We have Chester Finn, a client and individual and family advocate. He is located in Albany Capital Region. We have Marilyn Sada and Elfie Kazundi. They are both located in the Finger Lakes, Rochester region. And we have Josh Mosky from Long Island. Just give me one moment, folks. I would like to emphasize that these positions are paid direct staff hires within OPWDD. These are state employees. Our offices are located across the state, but it's important to understand that we all hold statewide jurisdiction. So, for example, although I'm based in Metro downstate, I and the other peers can support people across the state, which I actually do. Our unit is entirely comprised of those with lived experience, including our director, who has advocated for an immediate family member of hers with a disability. And we also have another staffer in the unit who has a family member that they advocate for as well. At this time, we all have lived experience, but that's no guarantee that the entire unit's gonna all be lived experience. Like, that's just where we stand at in the present. Next slide, please. I'm sorry, I'm slide 5. I'm sorry. If you could post slide 5 back up, please. Then you go back. Tell them go here.
Christopher, can you see the slides? Which one would you like us to be on?
Slide 5.
The one right before this, it should be.
The unit? Yes, that one. Thank you. As I stated, we are a team of advocates with lived experience. An acronym that we created to share our values is ARI, or AIR for short. We value accessibility, inclusion, respect, and empowerment. These, they feed off of each other and are just, they so crucial for the work that we all do, for the work that we do. There is a QR code on the bottom right of this slide, so if anybody would like, they may take a picture of that, and that will bring you directly to our Office of Advocacy webpage.
Works fine.
I would like to share that lived experience looks different for each person. For example, I am neurodivergent and have mental health challenges as well as physical health concerns. Without lived experience, we really wouldn't, we would be missing our identity. So it's just so important to acknowledge lived experience of those we're working with and supporting, and as well as our own lived experience. Next slide, please. Next one. Next one, please. Okay. As I was stating a little bit earlier, we aim our role, the advocates in our unit have a three-pronged approach to the work that we do. We advocate, we educate, and we improve. Advocating involves providing direct support and advocacy. We also educate, and that involves presenting on advocacy, inclusivity, accessibility, and disability rights, internally and externally. And internally and externally is something I would like to preface. We also improve, such as giving feedback to OPWDD on policies and practices. Just give me 1 second, folks. Some examples from advocating, educating, and improving that I have engaged with are supporting people with interpersonal skills, employment, and housing matters. I have presented on the unit and my role, as well as lived experience, both internally and externally. For example, like I spoke on my like employment journey briefly at an event. We improve, and we do this in multiple ways, but the main way is looking over things and providing feedback when requested. Next slide, please. Pure support in action. With this slide, I aim for you all to have the experience of just better, like, understanding and relating to the work that we do as a unit. We provide one-on-one support. We listen to people, provide guidance, and offer encouragement. I find it important to also note that we aim to guide those we are supporting towards their desired outcomes whenever possible, as opposed to giving advice, because we are all the expert of our own life. We all are in the driver's seat. So it's just important to remember that and just help people get to where they want, and not and be more collaborative as opposed to directive when possible. We share our lived experience. This doesn't have to be sharing in excess, it can be the opposite as well. One example is, I'm not going to go into specifics, but I was at a work event for the job, and somebody shared a diagnosis of theirs with me. And I happened to have that same diagnosis, so I disclosed that. And not only was that beneficial for the encounter with that person, but it also was quite cathartic for me. It was a little bit therapeutic in that moment for me. So the power of self-disclosure and sharing your lived experience can really be such a powerful tool. And I encourage you all to explore how and when you folks can share lived experience with those you interact with. We encourage self-advocacy. This involves helping people become effective self-advocates. One example is, like, I suggested some strategies for emotional regulation with somebody I was supporting. One example of advocacy efforts I know that I've achieved is, like, I was able to, I'm sorry, just give me one moment. Like, we all have our own advocacy wins, big and small, and what matters most is that we consider it a win, and that not everybody. So I will now move on to the next slide, please. Next, hold on. Okay, advocates help people build confidence, independence, and provide assistance as they navigate their journey. This can involve providing emotional support and a sounding board, collaborating on options, helping people come to the outcome they desire, and also providing resources and connecting people to the agreed upon resources. So we provide guidance that helps the OPWDD system be person-centered and inclusive. Person-centeredness is a big part of our beliefs and the work we do. Think of person-centeredness as like we are the captain of our destiny, and we know often what we need and want, and person-centeredness would be somebody helping us tap into our strengths and our desires and supporting us with living out such desires and strengths. We bring perspective of lived experience into policy and practice. A time that my advocacy efforts helped me achieve a desired outcome would be when I had to have an MRI of my spine, and I chose to have it under anesthesia. So I advocated to have them both condensed to the same appointment since there was a disconnect between scheduling, etc. Next slide, please. This slide is really crucial, and I feel is going to be very beneficial to those on this presentation, on this meeting. Part of the role of the unit, of the Office of Advocacy Peer Support Unit, is we also collaborate with families. Families play a vital role in the work of the Office of Advocacy. The insights and lived experiences of families helps inform the work we do. And I just want to repeat that one again. The insights and lived experiences of families helps inform the work we do. We can provide presentations on our unit and the work that we do to family-based groups and organizations. We can support family members by providing emotional support, resources, and talking through options. Lastly, family members will reach out via the same contact email and process on the Contact an Advocate slide at the end of this presentation. Next slide, please. This is our information on how to connect with an advocate within our unit. You may email our advocacy inbox at advocacy@opwdd.ny.gov. We kindly ask you to please include your name, preferred contact information, a short description of the support you're seeking, and any key details such as your county, OPWDD involvement, summary of presenting issue, and anything else. You all may feel free to take a picture of this slide for the reference. After you reach out, an advocate will be assigned to your case and reach out within a timely manner. We now have a few quotes that we would like to share. When people are supported to advocate for themselves.
Chris, you need to go to the next slide.
Next slide, please. Thank you. Thank you, Chris.
No problem.
Appreciate it. When people are supported to advocate for themselves, they gain not just services, but confidence, dignity, and choice. Your support reminds us that lived experience is not just a story, it's a tool for change. True inclusion means nothing about us without us. And these are from authors who are unknown, but definitely speak impact through their words. Next slide, please. We are now at the conclusion. I would like to open the floor for any questions pertaining to this presentation and the work of the Office of Advocacy. I'm not sure how we want to field the questions. I don't know if like Lisa or Alexis or one of you wants to help with that.
I can help you. This is Kathy.
Hi, Kathy. Thank you.
Okay. So in the room here, does anyone have any feedback, comments, questions? Crystal?
I was just wondering, so it looked like there's an advocate for each region, is that correct? Yeah.
Hold on. Let me just.
It looks like there's someone for Buffalo, but like, I know that's within our region.
Yeah, I can jump
We
in,
have
Chris.
somebody in Buffalo, actually. BJ Sasio.
Yeah, so this is Willow. Christopher, I'll jump in and you can fill in whatever I'm missing. We advertised statewide when we posted the positions, and we had applicants from wherever they happened to live, and we hired the best folks that applied at the time. So they're not necessarily representative of every region. We have peer specialists that are located in multiple regions, but they all provide statewide coverage through that.
Are you open to new advocates at all? In my council, there's an individual who's amazing self-advocate, and I feel like he would excel. And we're pretty far from Buffalo, but that's the only person that's close to us. So I thought maybe he could be an advocate for you.
Yeah, you know, since we hired this team, we've had so much outreach from other advocates really wanting us to post another round of hiring. So at the moment, we're still working with the group we have. We're increasing some of the hours that the advocates that you were introduced to are already working. And at some point, I'm sure we'll be posting for additional advocates, but not currently.
Okay, yeah, I know a perfect person. So thank you.
Perfect.
I see two questions up on the screen. Dawn?
Thank you, Kathy. Christopher, first of all, that was a very insightful presentation. Thank you so much. My question is the Office of Advocacy part of OPWDD? Here is my bigger question. We moved here from another state. My daughter's on the spectrum, and she was denied services. So as an example, would she be able to participate in the advocacy, or do you have to be part of OPWDD, like within the system?
Okay, to your first part of your question, Dawn, the Office of Advocacy is a unit within OPWDD, and we work very closely with the Commissioner's Office. And to your second part of your question, Dawn, without specifics, I would say that I would recommend like reaching out to the advocacy email, and one of the advocates would be able to like further screen and assess for support and help for her.
She said thank you.
Thank you, and I'm sorry I couldn't elaborate further on that.
No.
Specifics.
She said thumbs up.
Just happy with what you did.
Scott?
Thanks, Kathy. Christopher, great presentation. I appreciate it. So if I wanted an advocate to come out and talk to my counsel in person, is that a possibility? Or is it just remote? Or what kind of things do you do in the community?
The best thing would be to send an email to the advocacy email that we provided, and it could be possible, but I can't make promises. But I hope that answered your question, Scott.
Sure, that's good enough. Thank you. I'll send them.
Sorry.
I know that, sorry, I'm going to jump in again. This is Willow. Christopher didn't brag as much as he could have about this small team of advocates, but they have done dozens of in-person events. They've joined me on panel discussions. They've attended strategic planning forums and self-advocate conferences. They also do in-person new employee training for OPWDD with our state-operated employees. So they certainly make appearances in person whenever they can accomplish that. Again, it sort of depends on when, where, who, what part of the state, et cetera.
We have a question in Metro.
Go ahead, Deb.
Well, Chris, you did it first. So this is the second time we've been together at this meeting. You've done a fantastic presentation, and I'm very happy to see this unit. And my council would love to have you participate. We know you can't always come physically, but we'll figure out how to get you in virtually. And also, I know in New York City, we have what's called Development Disability Councils. I want to make sure that you're in our big family support fair in June. But I thank you very much because this was a very excellent presentation. And thumbs up, major thumbs up.
Thank you very much, and we will be glad to support the best that we can.
I appreciate that very much. Thank you.
Welcome.
Thank you, Deborah. And do we have any other
What, you have a question?
questions? Sure.
But it's statewide member.
Wait, what's the problem?
Can you ask this? If
Metro, did you have something more to say?
Yes.
1 second.
Can I let a non-member talk quick? Just to make it fast.
Audience
What,
member.
presentation?
no, it's fine.
Sure, we'll have it, that's fine.
All right, ask. She said ask.
Okay, thank you. So, are parents able to also contact the Office of Advocacy or speak to peer support units, if it's regarding their child? Like, I'm thinking more about FSS, people that are in FSS youth.
Yes. Family members are able to access services from the peers in the unit, just as well as persons with disabilities.
Who?
Yep, and I just wanted to, oh, someone talking?
She just said thank you.
Okay, great. Yeah, I just want to piggyback off of that. Hi, I'm Lisa Salimi, the Director of Advocacy for this wonderful group of advocates. I learn from them every single day, but their primary role and responsibility is to provide that peer support, but within that peer support is they talk to family members. So they receive cases and calls from family members. I do myself. We recognize the importance of the collaboration. So please, like if you feel, reach out, as Christopher mentioned, and we could share this PowerPoint is reach out and we would love to connect with you and kind of hear your thoughts and stuff. I mean, this team is here to help improve the service. I think we can all agree we can always improve no matter what. And that's what they're here for. So they love to hear from family members. Since I got on board in February, they have conducted numerous presentations like Christopher talked about. Take the time to meet with family groups such as this group, and we definitely value your advocacy and support. So again, we want to appreciate for this opportunity. Christopher, you did an absolute fantastic job. And yeah, we thank you all for this opportunity, and we look forward to the partnership.
Thank you. Any other questions out? Any more here with the summaries there?
Just a quick question is, do you provide any kind of trainings for new advocates who like to be advocates, and, raise their voice for special needs?
I'm not sure
Go ahead, Christopher. Sorry.
if this is exactly what you were referring to, but as advocates, we can work with people one-to-one to develop self-advocacy skills and help people become the best self-advocate.
And I just thank you, Christopher, for that fantastic response. I just want to piggyback off that as well. Part of the advocate's role is to help people with their self-advocacy skills. We always talk about advocacy as a spectrum, and we meet each person where they're at, whether we are advocating on their behalf, helping them advocate for themselves, helping family members with advocacy skills. So some of the cases that we see come through to this team is maybe someone is just stuck on, how do I appropriately and efficiently, communicate my concerns. I feel like I'm stuck there, and that's where this team of advocates would help those people, whether family members or self-advocates or people who are looking to develop self-advocacy skills. That is part of their job, and they do provide that support. I hope that answers.
Thank you so much, and thank you, Christopher, and the entire peer support team for the work that you've been doing. And I'm personally impressed with all the numerous presentations and face-to-face assisting our commissioner on her panels. Thank you very much. It was a really informative and a great presentation. So now we're going to move on. Okay, thank you. The actual family support members, priority areas, and updates from our subcommittees. And we're going to start off with Scott Brady from the Advocacy Subcommittee. We're going to have a discussion on family support funding accessibility, which means many different things. So Scott, I'm going to ask you to start.
Yep. Thanks, Kathy. Oh, I got a slide. Well, first of all, it's tough to follow Christopher. we're going to focus on bureaucratic stuff after that rich presentation. The other thing is I might cough. I'm not feeling well. I wish I was there to join you, but so excuse me if I cough or sneeze. So there are two issues that the advocacy group and the statewide committee discussed the last time we got together and a few meetings before that. The first is we had questions about the 25-26 enacted budget. The budget language that appears in the aid to localities language has $97 million identified for services and expenses related to the provision of family support services. In the 3 previous funding periods, that same language, about $97 million, appears. So you look at that number, you say, oh, it's a big number. And then you look at what we actually dispersed to family support services, and that was, and we can't do 24, 25 because we're in it, but the 3 years before, 21, 22, and 22 and 23, and 23 and 24, we had 47 million for that first period I talked about. This is disbursement, 44 million for 22, 23, and 41 million for 23, 24. So the question is obviously, you know, what happens to all that other money? And, you know, we all talk about need for services, being responsive to the community and families. It seems like we're leaving money on the table, and we shouldn't. We shouldn't leave money on the table. I don't know if, let me go into the second part of our discussion, and then I'll ask other committee members, statewide and advocacy, to chime in if they would. The second related issue to that, so that's the big picture money, 97 million, and a lesser amount dispersed. It has to do with the allocations per region. So we do have sub-regions. So it's not, you know, Region 3 has, I think, 4 sub-regions. So keep that in mind when I talk about this. So in each local council regions, we have annual underspending. The question around that is, how do we reallocate chronically underspent money? So since COVID, in our region, we've had a number of programs, and I'm sure other people would agree, that have underspent their money. It shows up as a performance issue. You know, you had this amount allocated. Instead of serving X amount of people, you serve less and underspent. So these could be in certain program categories or within a bigger provider who have multiple program types. In some local councils, there have been program closures and terminations over, again, pretty much since COVID. And we've had no mechanism to get that money back into the region. In the past, we used to do, and I have a short history with my local council, but they used to tell me they'd be able to reallocate without, you know, a lot of hoopla around, you know, RFPs. And then I think somewhere after COVID, we said, well, we can only reallocate if we had an RFP process. So how would we do that locally so we don't leave money annually sitting on the table for program closures and underspenders? So that's the big local question. So I don't know if any of the other members of the committees want to chime in, but those are the two areas. So the big picture area, 24,000 level, you know, $97 million, we disperse a lot less. And then the local council issues around allocations and subsequent unallocated money because of underspending, program closures, and other things. Anybody else want to chime in from the statewide or the advocacy committee?
Dawn, would you like to talk about the issues that you are faced with? By the way, Scott is from the Region 3 Capital District.
Yes.
And where's Dawn? Dawn is from Central New York Region 2.
Yeah, so what we're, excuse me, what we're seeing in our area is in just a big, wide area that Scott hit a lot of the issues with, funds aren't being totally utilized for a lot of different reasons. And also, we have one county here where literally we just lost our last FSS program in that county. We have a lot of rural areas, and so it's already been difficult for a lot of families to just get to, get the services, because of transportation and all of that. But now we're actually starting to see loss of services here for FSS. And it's starting to become a pattern and a bigger problem in certain areas within our region. And quite honestly, we're at a loss on how to assist here and provide assistance to the agencies and just address this problem. So I thank Scott for bringing this problem to light, because until we talk about it in our area, we're just seeing it's progressively just moving along in a negative direction right now. And we'd really like to see that change.
We have a question here in the room. Crystal?
To support what Scott was saying, I know there are agencies across the state that stopped having the family reimbursement because the allowable and non-allowable was so restrictive. And like, for example, I had an FI tell me that it was so restrictive that it was ridiculous, and it was no longer serving the purpose of helping the people that we serve. And I know in a previous meeting we had someone talking and crying about the diapers situation because they couldn't get a brand name diaper, and one of the staff, I'm not naming names, said that they did not want to have people get designer diapers when all they wanted was a brand name diaper that wouldn't leak. And so I know there was like some pretty severe restrictions on different things on the allowable and non-allowable list, and agencies, we have less agencies to provide these services. And I think of with this much amount of money that's still unused, that perhaps this could be revised to further help the individuals that we serve, because it's in my opinion too restrictive, and we could have more agencies providing the service for us, but it's not because of the restriction. And with having this much excessive amount of funds, it's not fair to the people that we help, because it's not as helpful as it should be. Thank you.
Anybody else have a comment or a question in this room? Dan? So, excuse me, Crystal was from Western New York, and Dan is from Hudson Valley, Region 3.
Hi. Yeah, really briefly, we had a council meeting last night, and one thing that got mentioned is that respite funds were drying up with one agency, and so they try to refer them to other agencies, but you get to a certain point where there's no money left. And I know you have specific guidelines and rules and Medicaid, things that you have to follow, but it would be nice if we saw that, if we could identify it. And the state is the last resort, as I heard from the deputy regional director, that it would be nice if they could then supplement it, if they had the ability to do that when there was a real urgent need, like for respite. I mean, that's one of the key services.
Dan, maybe you could clarify, is the respite provided by OPW providers? And you're saying there's a shortage of respite now?
Well, it was actually, and I guess there's other agencies that do it as well. you know, that they have grants to do that. I mean, that's one thing that our council, I'm going to recommend that we do, is that we look at all the ones similar with respite, and we kind of monitor the levels of the amount of money that's left, so that we can know to ask for it before it's too late, like December. You know, their families are being told there's not any more money, you know, and we need to be a little more proactive as a council on that.
Okay. Any other questions or comments in the room here? How about, oh,
Okay.
I see
After
Karen.
Karen.
All right, Karen. Karen's from Buffalo. Well,
Kathy,
Finger
can
Lake.
you hear me?
Yes.
In my region, there's a concern in the agencies that they don't have enough staff members assigned to the FSS programs to fully serve the individuals that are asking for the services. So that is a concern in the Finger Lakes region, and the programs seem to be low. The FSS programs seem to be kind of low on the totem pole of services at the agencies themselves. So we might want to take that into consideration when looking at this problem.
Thank you, Karen. Jan, I see your hand up.
Thank you. I'm also in Region 2, and we have one contract that has gone 100% unutilized, and the primary reason is because of the restrictions in the ADM regarding respite being provided by a member of a household. This is a contract with an area that is culturally different than many areas, and it's a cultural issue where multi-generational families live together, and none of us can judge their reasons for how that has happened, but they're very protective of outsiders being involved. And because of this, all of their family support reimbursement respite requests have been refused. I really just feel so strongly that no family is getting rich off of family support or off of respite. And if it's one small thing that can help families, I hope that those ADM can be revisited on items that are so restrictive.
Are there any other questions, comments?
Kathy, I would definitely second Jan. Nobody is going to get rich with the funds respite services provide to the individuals. Getting services for respite, it's very important for individuals to remain healthy and safe. And this gives a little break for the families. So that funds has to be considered as necessity, not like a luxurious part of the life for the families. I think there is a different concept that which is growing. I don't know whether it's amongst our OPWDD hierarchies or at a local level, but that has to be addressed. Second thing is the DME, which is medical equipment providers. They provide the pull-ups and diapers. And it's the choice of the family to pick up the pharmacy where they want to get a designer's or a branded diaper or pull-up. And my boys get branded pull-ups. I can also give the name, but it's in Queens. So I don't know if they could FedEx, and they could apply billing. That is a big question. But definitely we have to address these certain categories, and we should not confuse ourselves with what items are straight Medicaid and what items should be, we circle back to our hierarchies at OPWDD, just as respite services, ComHab services, even self-direction. Some of the FIs have no knowledge of what IDGS and OTPS factors are. So it's not just FSS reimbursement, it's go far and beyond. We have to have a clear concept.
Thank you, Aaliyah. So we're going to move on because we have a lot of concerns, and we'll start with OPW. I don't know which you would like to respond to.
Kathy, thank you. So we actually have somebody on from our fiscal management unit, Craig Rogers, who will be able to answer some of the questions that you all had sent to us previously related to how unspent dollars are used and how that's allocated and whatnot. So I am going to turn it over to Craig to respond to that, and then we'll have to separate out the conversation that's specific to the ADM. So Craig, I will turn it over to you.
Thanks, Alexis. So yeah, I think, maybe on the initial point of the appropriation amount, what was it, like 97 million roughly, and I think there's a distinction to be made in terms of the appropriation and the funding that's available to the agency. So, the appropriation amount is what's passed in the enacted budget, and that's the authority to spend. But really, the financial plan that's published by the Division of Budget every quarter really governs the cash of what is available to the agency. So, and it's like this with every program in the state, right, where the appropriation exceeds the cash that's available, which makes sense, right, since we don't want to have the cash but not have the authority, the legal authority to spend it. So, FSS, I think the approach is north of 90 million, but I think what is available in cash is less than that, right? And I think the combined value of all the FSS contracts is something like 55 million. So, the underutilization in terms of actual disbursements is, I would compare it to the 55 million for what the total outstanding contract liability is. So I just wanted to sort of make that distinction there. And, as was pointed out, I think during COVID, it certainly expenditures went down, and in the past 2 years, we've seen, FSS spending starting to rise again, back to that pre-COVID levels. I think the other thing that was mentioned was, the reallocation of funds. I think this is a state-funded program, right? So we are subject to the state procurement laws. So any, new services that are paid pursuant to a contract need to be competitively bid. So, I think that's just the framework that we have to work within. And in terms of underutilization on the existing contracts, I think that's something that we can think about as a group, right? And if we want to look at the contracts that are being fully, very underutilized, and if we want to use, reduce those contracts and reprocure, part of that is something that might be, worth considering further. And then in closed contracts, I think now that the $3.5 million RFP is, getting to the later stages, we've started looking at the contracts that have closed in recent history, and we're looking at that now to sort of see what the impact of that is, and depending on the results of that analysis, that'll inform what our next steps will be there. But so we are cognizant of that, and we are looking at that. I know a lot of other points were sort of brought up, some of them specific to the ADM, but I think those were the major ones that I wanted to touch upon.
Craig, so if I could just follow up, so you're saying that you think there's been an increase in spending since COVID in FSS programming, and the information I have is that it's actually gone down. And our concern is, for me in my region, and I'm sure in the discussions we had with other regions, we don't want the money to be bid statewide. We like it to stay in the region. So we, in the past, we get an allocation, you try and meet the need in your region. And it's really not a lot of money, but we want to be able to reallocate within the region. And I'm sure there's a way to do an RFP that's just not statewide and still abide by procurement rules that the controller has. So having an RFP within a region doesn't seem unreasonable to us. We want to get that money back out to folks. We have some counties who are very underserved, especially in the rural areas. And then maybe service-wise, you heard some people talk about reimbursement. I'm sure in every region, there's some areas where we could use more money that are currently underfunded. So those are the things we think that we should be able to do to get that money back out the door, like you alluded to.
Okay, yeah, I think, I guess the FSS spending has it took a dip during COVID, right? That's true. And then I think in 24, 25, and 25, 26, at least year-to-date spending, have seen increases, from the 23, 24 spending. So it is definitely trending upward back, approaching that pre-COVID amount, and statewide spending I'm talking about, of course. But yeah, and I guess in terms of any new allocations, what we did in the $3.5 million RFP is we looked at, by region, how many individuals are living at home, right? Since that's really the target population for FSS services, right? And we tried to, allocate it based on the relative percentages. So, that's how we did it in the past. And, I think we're open to collaboration with the committee, right? And then on any future procurements. But I don't know if that addresses your comments. But.
I think it does. I think, we were waiting for the RFP to happen so that we would have a way to get money back out the door. We went through a whole bunch of stuff, conflict of interest forms, bylaws. We did all these things to prepare for the RFP. It would seem to me once we get this RFP out the door, we're now prepared to do it again and get other monies out the door that are sitting on the sidelines. So thanks for your answer, though. I appreciate it.
Deborah, you have a question?
Yes. Are we, since the reimbursement ADM was brought up during advocacy, when are we going to discuss the reimbursement issues?
Next, Deborah, it's next on the agenda.
Thank you.
I do have a question. I really would like you to go over again the appropriation and the cash. Maybe it's just me, but I don't understand. If you have 79 million that you are authorized, allowed to use, but we're not using it, why are we not using it?
Craig, this is Willow. Can I just?
Oh, sorry, go ahead.
No, that's okay. I'm just in terminology that's not from a fiscal director's office. So there's I think what he's saying is there's a difference between what we're technically authorized to spend, which is one number that gets published, and then the actual money that we are given to spend as an agency, and those two numbers are different.
So that other money could be funding other programs?
The other money is never in our hands to spend, so it's...
Oh. Okay. I do have a second question or comment. Like Dawn had mentioned, the providers are just sending back the contracts. They don't want to do anything anymore. So there's money there. And years past, we had an ability to keep track of that money, and it seems that we've lost that ability. Even with the 3.5 million, we had much more, and I know that because prior to the release of the 3.5, we had people up in some amount that was up to hundreds of thousands, people in Hudson Valley, hundreds of thousands. And I would propose that there's some way that we could keep track of this money, where contracts are turned down or contracts are terminated, and full transparency, where's the money? Quote, where's the money? So maybe we could talk about this at another meeting. Anybody? Oh.
Yeah, I think that's fair. We can absolutely talk about that at a future meeting. But I think what's important to flag is that we've been trying to develop the infrastructure, right? It's been years since we've been able to get an RFP out the door. So not to, invalidate or minimize the conversation happening right now, but we did need those foundational kind of building blocks to build upon. So we're in a much better position right now. But I know that at the local council level, there has been the ability for folks to kind of make recommendations on where funding is kind of being reallocated within an existing contract for a provider. So that's something that we've been able to actively do. But I think you all also know that we have a bit of a bleak financial future given the current administration. So that's another thing that we just need to address, the elephant in the room. So the federal administration, not New York's administration.
Thank you, Alexis. So I'm going to turn this over to Gail, and we're going to move on to the reimbursement ADM.
Yep, I should check in with Deborah. Deborah and I are members of the FSS reimbursement subcommittee, and we recently met with some members of Hudson Valley West and had some really robust, rich discussion about some of the things that they're struggling with and had questions about. Deborah, I'm just confirming you wanted me to cover those points that we discussed with them and then turn it over to you?
I just want to, when you finish, you want to add in, or you want me to add in quick what I wanted to say originally?
Okay. All right.
Most important piece for the reimbursement ADM is, and I have seen it does help, is that we have to start encouraging our families on the councils to fill out those consumer satisfaction surveys, especially if you know that this program is working, we'll use the reimbursement only. And you know that they need more funding. By putting that in and giving us the actual data, that helps us to advocate better. Because it's not just only I'm saying, okay, I'm Region 4, I'm in Brooklyn. We have to make sure that the whole state, it's a statewide family support program, we want it to continue. So we do need those consumer satisfaction surveys to be filled out by the families. We need to encourage them. And that's the big piece. And I'm letting you finish the rest, Gail, but I just wanted to make sure I got that out. I'm ready, whenever you are. Did she hear me?
So, yeah, Deb, she can hear you. I just wanted to jump in and just address comments that were made before this particular segment. So, because I know that there are families listening, and I just want to make sure that we're always really clear about sort of opinions, reflections, and fact. And just specific to the comments on the diaper, we have never specified requirements on a particular brand. Our ADM and the accompanying document speak specifically about ensuring that if diapers are covered by, Medicaid or insurance, then that's the initial, obviously, access point. So I just wanted to jump in and clarify that because it's prescribed in the attachment in the ADM and the language is very clear. So I just wanted to make sure that there was awareness around that.
Thank you, Abiba.
Excuse me, Abiba, I just want you to know, I totally understand what you were saying about the diapers, and I do understand that issue. And I have explained the families that when it comes to diapers, I have given them options, and I never saw it in any writing. It couldn't be a brand name if that's the best brand that will work for the child. Unfortunately, people, it's very hard because when you're an adult who has to wear diapers, it's a very hard thing to handle and to do. But I understand what the ADM was saying, and I understood about the issue with the diapers. So I wanted to say thank you, but I want you to know that was not on my radar. I'm talking about the consumer satisfaction survey, because I have found for years that I've been on, that's how we've been able to advocate for the agencies to get more funded. Or if there's a problem, we can ask our local DDRO staff to step in and check it. That's where I was coming about the consumer satisfaction survey. I just wanted to make sure you understood where I was coming from.
Thank you.
Thank you.
Thank you, Deborah. All right, so Deborah and I met with members of Hudson Valley West, and they shared some different things with us during that conversation. They requested and wanted us to share their thoughts, and we might actually hear from some of them a little bit later during public comment as well. They indicated the need for a more structured RFP, request for a proposal, process in the future. They recognize that agencies that are strong performers tend to use their allocated funds quickly and efficiently, which can leave them without necessary resources partway through the cycle. In contrast, other agencies are less effective in distributing funds. They often end up retaining large amounts of unused money and creating an imbalance in service delivery in Hudson Valley West area. The current $3,000 annual cap for camps, they also feel is very insufficient. Reasons being, many families report that the $3,000 yearly allowance doesn't come close to covering the cost of camp, especially when specialized support is required. Children with higher levels of need often require a one-to-one aid, which significantly increases the overall expense of attendance. Families whose children do not qualify for waiver services face an additional financial strain as they have no secondary source of support to cover the gap. As a result, some children are unable to access appropriate camp programming, leading to reduced opportunities for socialization, skill building, and structured summer engagement. Increasing the funding limit or offering a more flexible structure based on level of need would help ensure that children with more complex needs are not left without meaningful summer program options. And then the third topic that we discussed was parents reporting that community classes are often improved very easily, while what they feel are essential supports are often overlooked. Many families have shared concerns in Hudson Valley West that requests for community-based classes or lower priority activities tend to move through the approval process quickly. At the same time, services that directly access more urgent or significant needs are frequently denied, delayed, or questioned, causing frustration and confusion. This pattern has led parents and families to feel that the approval system is not aligned with what families genuinely require for their children. Families would like to see clearer criteria, better communication, and more attention given to needs-based requests rather than activities that may be easier to process administratively. Improvements in this area could help restore trust and ensure that supports are allocated in a way that reflects real-world priorities rather than procedural convenience. So that is a summary of our conversation with Hudson Valley West. We do have Mayor Bushinger here with us today, a representative, our statewide rep from that area. Mayor, did you have anything that you wanted to add?
No, I think you presented it very well. I have nothing to add to it.
Okay. Deborah, did you have anything further to add?
Go.
Yes, first of all, Mayor, thank you very much for meeting with us. I did appreciate, and the one important thing I just wanted, for people to know historic-wise, it used to be reimbursement just per family. We have been able to, years before COVID, we're able to have it switched from, because some families have more than one child with a developmental disability living in home. So it is very important that that stays, and we want to make sure that we work on something to, on certain programs, get more of the funding up higher, not so that we can help more families. And that's the only thing else I have to add. I hope also fellow members of our statewide can let us know what help is needed for reimbursement ADM. Gail and I would appreciate it very much. Thank you. Gail, is there anything else?
No, they're doing a joke right now.
And Gail, is there anything else I have to say or do?
No, I think you covered it all. I think we do want to give an opportunity to OPWDD to either respond today or at a future meeting regarding Hudson Valley West's concerns and comments.
Whatever is the appropriate, I'm fine with. Did you make me?
Can folks hear me? Gail, and I guess I can direct this at Mayor as well. Just a point of clarification. So when the comment was made about clearer criteria or guidance, is that directed at the ADM overarchingly or the interaction with FSS providers?
My interpretation was with FSS providers, the communication. Okay. That was my interpretation, but I could be wrong.
Okay.
We did have robust discussion, and there was a lot of conversation around these things, and some of the reasons that we've learned historically why some of the decisions are the way they are were shared with Hudson Valley West. I just know that they would really like to hear that from OPWDD as well, if possible.
Because the reason why I'm asking is because obviously for us to be responsive, it's important to understand whether folks are raising maybe a training and clarification issue versus something more structural. So the more specifics that we can have behind that, like for example, the summary that community classes, and I know when we use that terminology, people automatically think of community classes under the IDGS frame, which is self-direction, right? So are we talking about reimbursement for recreation-related activities under FSS, or I just think that the specifics there matter so that we can really be clear about what we're responding to.
I think we discussed the vitamins issue. That OPWDD is asking for more documentation or doctor's letters before providing that, which I don't think it's written in the ADM. That could be something for more specific.
I'm sorry, Mayor, can you clarify that? Doctor's notes for what?
Sometimes families are asking for reimbursements on vitamins or these type of things. So, and OPWDD is not approving it. They are asking for more clarification and more clarification, which is not specifics in the ADM. What is needed in order to get these type of items to be reimbursed? Does that make sense? They're needing, they're needing doctors.
Okay, so I think maybe in or out this meeting, those specific examples would be helpful because we did specify at the request of the committee where a physician's or clinician's note would be needed for limited items. So if there's items where folks are requesting clinician or physician's documentation that are not noted in the ADM, I think having those specific examples and knowing where that's coming from would be super helpful so that we can impact it.
So Deborah and I can work with Mayor and Hudson Valley to kind of get some more specific examples and drill down to bring that information to OPW so that you can respond. And we can make sure that this is a helpful dialogue.
Thank you.
I agree.
I agree with Gail. I agree with you because Mayor, we need to work together so we can do a correct justification of why these may be needed. So I'm very willing to work with everybody, and thank you, Mayor, for reminding us about the vitamin therapy, which is very important. Thank you.
Okay. All right, are there any comments or questions in the room on this topic before we move forward? Okay. Okay, we'll move out to virtual land. I keep doing this and you want me to back up, sorry. We'll move out to virtual land. I see a hand up and that is Scott Brady from Capitol.
Yeah, thanks. Just a quick question, just popped in my head when we were talking about the approvals for vitamins, not to weigh in on whether that should be approved or not, but there is, we've discussed in the past, I think mostly in our private statewide meetings, the lag time between approvals. So during the summer it came up where somebody applied for camp or whatever for reimbursement, and that by the time they went through the whole process, the camp was already started and ended. Is there a way for us to track the approval times for some of these outliers? So there's a lag time, and you know, some families don't have that kind of time, you know, where, you know, they get an approval or they get denied, they have to go back to the doctor, and there's a set of denials. By the time they get approved, the event or the need might have gone away. Does that make sense?
It does. This is Gail Scott. I think there's a number of reasons why things could be lagging, and it could be missing documentation, missing, you know, additional communication needed, eligibility being met. But I would recommend that the specific agencies track that lag time, and if they have some concerns about their RFOs and what that is looking like, maybe they could share that with the reimbursement subcommittee so that we could work on that.
Right. I'm really asking the state, Gail, if they do track that. If anybody can answer. Just I'm curious.
Yeah, this is the BEBA. We don't track that because if items are permissible via the ADM, right? And I say that more broadly around eligibility for the individual, et cetera, then they should be approved, right? It's the items where perhaps folks are not clear about or require additional clarification that get elevated through the chain, you know, to OPWDD, right? And so we're not tracking that specific time frame for approval. And then I also just want to highlight, you know, the conversation around perhaps the providers doing this, because I also heard in a past segment that there are additional burdens being put on providers specific to this ADM. So I just think that we need to really just sort of think about what the ask is in trying to make this as seamless as possible.
Thank you.
Are there any additional questions on this topic? I don't see any additional hands raised. Okay. All right, we're going to move on to the next segment of our meeting, which is going to be local council presentations. And we will start with Region 2 with some noteworthy events and activities that occurred. Next slide, please. Region 2, one of the agencies in that area hosted a resource fair in a very creative way. They did it through a trunk or treat. And this is upstate New York, in an incredibly rural community. Actually, Candor, New York. Most of you might not have heard of that. Very rural, and they had about 500 attendees, which is very significant for this area. A lot of great information was distributed. Lots of programs got to kind of educate people about what they do. Referrals were made, and it was a huge success. So we just wanted to highlight that, event that occurred in Region 2. Next slide, please. And another event that Region 2 hosted was Jordan Allen. He's actually a neurodivergent magician. He lives in Kentucky. He does some great magic. He's very entertaining, but he's also neurodivergent himself, and he uses his show to educate and inspire those that attend. And he shares his passion, what he turned from a passion into a career. So the neurodivergent magician Jordan Allen came to Region 2 as well, and that was also a successful event hosted by that region. Next slide, please. I think this might have been an accident, but there is an organization, RACR, in Region 2 that hosts a bi-weekly online game show night. It's very interactive. They have great attendance at those. They're fully virtual, and it's all age appropriate. All the game shows center on advocacy, social skills, and safety. Some questions are posted about online scams to be identified. They love to yell when it's a scam, so they get really into it. Some answers are intentionally wrong, so that folks practice speaking up and pushing back for themselves, and they get double points when they catch the daily doubtful. In jeopardy. They also have a Who Wants to Be a Millionaire game show designed specifically that was adapted for folks who use text-to-speech programs. And there's a little bit of pop culture and trivia sprinkled in to cater to the group's interests specifically and keep it light and fun. So it's just a really creative and engaging way for some of our peer advocates to learn things and have a good time with some of their peers. So just another successful event taking place in Region 2. And through a family support services funded program, yes, thank you. Next slide, please. All right, I'm going to turn it over to Region 4 and let Brooklyn tell you a little bit about one of their successful events, noteworthy.
Hi, everybody. Brooklyn has been doing what we call our Developmental Disability Resource Fair, and we have partnership with Inclusive Services from the Brooklyn Public Library. The head librarian, her name is Carrie Banks. She has branches where it's not just developmental disabilities, any form of a disability, help young families, but also help the parents know what way to help their child. And we've been going around all of the libraries, and we also have been supported by, besides our council, we also have the Brooklyn DD Council, but even more important, our local Brooklyn DDRO has been very helpful. You go to the next slide, please. Okay, you see all these lovely, lovely photos. Okay, this is showing where we show you, these are the flyers. We made sure that in July, because it was the 35th anniversary of the ADA, we celebrated 10 years. We were in different parts of the library. We did for July, we were in what they call Central, or people who know Brooklyn, it's called the Grand Army Plaza main branch. And we had, I don't know, how many people did we have, Chris? We were so overpacked. It wasn't.
That day was 225.
Well, 225 people. And you go to the next slide. All right. These are the agencies that have been working with us, not only from OPWDD. As you see, Sydney has a citywide program that helps not just the individuals, the families. We have the Sunshine Network for travel training, Heaven's Hands. You see the Brooklyn DDRO and the Brooklyn Developmental. We have also the New York City Commission on Human Rights, the MTA, Chance to Dance, My Time Inc., Brooklyn Community Services, AHRC, Step to Step. We have had many, we keep rotating the agencies, and you see in there's the Brooklyn, and we also have Synergeria, Parts Way, but also if you see the lion, it's the Angela Haskell Braille and Talking Book Library. Even though they are come out of the New York Public Library system, they have a contract where they can go to all of the 5 boroughs as well as Nassau and Suffolk County. We're trying to find out when they can also participate up in Westchester and in Rockland. Can you go to the next slide, please? Thank you.
Oh, go
back.
No, you have the numbers. They don't.
Oh, okay.
Yeah.
All right, so we've had like in January, we were at Greenpoint, we had more than 45 people. In February, we're at Bed-Stuy, more than 60. We've been through the Mill Basin, we went to Sunset Park. These are the names of the library: Park Slope, Midwood, Coney Island, Sheepshead Bay, Back Beach, Bensonhurst, Dyker Heights, and downtown. We have had more than altogether, we've had more than 1,000 families we've helped. And I want to bring up one important point. We've also helped families with non-OPWDD issues. We've had a family who was being discriminated against, and the New York City Human Rights Commission, as well as Sydney's, was able to protect this family. So we've been very pleased and happy that by going around our borough with partnership from the Brooklyn Public Library's Inclusive Services, we've been able to reach so many more families. And in fact, they beg us to come back, but we can only do so much per the month. But we have, and OPWDD has been able to sign up so many families, but as you see, we also have New York City DOT. We've been helping families get their it's no longer going to be the Metro card, it's going to be the Omni card, but also we're trying to make sure families who have issues with New York City DOT, especially if they need to get the parking plaque because of their child's disability, we do have them come and we make sure that we give them the right information. So we thank, as you see, we have been having a great partnership with our library, and we're still continuing, because in January, it's going to be my branch, the Homecrest. So I finally don't have to travel far, just walk 3 lovely blocks, and I'm there. And I will tell you, we've been getting so much feedback from all the librarians and the staff, they can't wait for us to come back. So, and we, as you know, Brooklyn we have our own website, which is www.efssac.org. We have, how many people have we had? Over, yeah, on the website alone.
3 million.
Altogether in the year, over 3 million. So we've been helping to do outreach. And yes, we've also, one more important thing, we've helped families sign up their children to vote. We don't tell them who to join. We don't tell them they could be Republican or Democrat. We just tell them they have the right to vote. And that has made them. So with that, Brooklyn says, we thank you for listening, and we will, if we have any more, and by the way, and I will say, my son, Christopher, is the chair of the outreach committee. So with that, thank you so much, and I know Region 5 is next. Well done. That make you guys look good?
Over to you, Mary Fasano.
Oh, here I am. We have a couple of pictures that you can see. Luckily that I got them, so you don't have to look at me. On October 3rd, our Long Island Council held its 30th annual legislative breakfast. Over 500 people filled the grand ballroom at the Hilton Hotel in Melville. The room was overflowing with people who receive OPWDD services, their families, self-advocates, and the staff from the provider agencies. In addition, there were more than 30 elected officials and/or their representatives from federal, state, county, and local government. The commissioner addressed the group and stressed the importance of maintaining the valuable work done every day across New York State by so many people like those gathered there that day. Senator Monica Martinez and Assemblywoman Jody Giglio also spoke of their support for the work of OPWDD, and they pledged to encourage and urge their colleagues to do the same. Our theme for the day was protecting the faces of Medicaid. Our 2 other speakers electrified the room with their personal stories. Kevin Chrisman, self-advocate, talked lovingly about his father, who is now approaching his 80s, but has never failed Kevin in his lifelong struggle to reach his personal goals. He has supported and loved him and has fought vigorously to make the system work for Kevin. However, the question Kevin asked was, why should there be a struggle? Our other speaker, Jerry Athenas Bennett, talked about her daughter Angel. Jerry adopted Angel out of the foster care system and took her away from years of abuse. Life was not easy. There were many obstacles along the way, and unfortunately, some still continue. But with the love and caring and unending advocacy of Jerry and her family, Angel has grown in confidence and maturity. One of Angel's proudest achievements is that she is a gold medal Special Olympics world champion in powerlifting, no less. Our legislative breakfast is our chance to put before the powers that be a name and a face to our family members. Several years ago, the legendary Assemblyman Harvey Wiesenberg listened as one of our members told of his heartache as he raced to get to the bedside of his little girl as she lay dying in a Connecticut facility. She was there because no place on Long Island could meet her overwhelming medical and developmental needs. The Assemblyman not only listened, but he spearheaded the establishment of Angela's House, the first of 3 houses on Long Island for medically frail children. Years ago, OPWDD, then known as OMRDD, held annual statewide conferences to examine all aspects of family support. During one of those conferences, I overheard people talking about what they had learned. One person summarized it succinctly. He said that family support is whatever it takes to keep a family whole. We on Long Island will continue to drive this message home to our legislators. Thank you.
Well said, Mary. Thank you.
And I have to just add, Gail, Deb, and Mary, unbelievable. That's a lot of work. Mary, our DD councils put our legislative breakfast together, but a family support council pulling something like that on their own, unbelievable. And the dedication every week or a couple of weeks, Deb, really, all throughout Brooklyn. You're never going to get all those libraries. Brooklyn's too big.
Don't say never to Deb.
Oh, yeah, that's true.
We actually have time for one more success story, and that would be from Ann Scher in, I believe, Western New York.
Right. Thank you, and thank you for squeezing me in at the end. I appreciate it. I want to talk really about 2 family stories. It's with the unique statewide program, family support program, Parent to Parent, and I'm speaking from Western New York. A family explained that Parent to Parent has been a lifeline for families like theirs. When their son was diagnosed, they attended an in-person group feeling vulnerable and overwhelmed. That group provided what every parent in that situation needs, a caring ear and validation. It quickly became their anchor during a difficult time. Through Parent to Parent, they discovered resources beyond groups, including parent match programs and guidance with OPWDD. The family explained that navigating OPWDD was daunting, but with help, they found doctors, specialists, and agencies to complete the process. That support made all the difference. Many parents don't realize this kind of help exists. Parent to Parent reminded them that they are not alone, and thanks to this organization, they no longer feel that way. Another family story is when a 3-year-old daughter was diagnosed earlier this year. The parent felt overwhelmed with questions but could not find answers, neither from the pediatrician, the county's Department of Social Services, nor online. After 3 months of uncertainty, a fellow parent at a playground asked if they had heard of Parent to Parent in New York State. From that moment, everything changed. They began joining webinars and monthly Zoom chats with parents across the state who were experiencing similar challenges. Very quickly, they learned how to advocate for their daughter and discovered new avenues of therapy to explore. Today, their daughter is thriving, and they credit much of the success to the ongoing family support that received from Parent to Parent. Sometimes we lose sight of the individual cases that really do make a difference in families because of the lives that we can touch through supporting each other as families. Thank you for letting me speak.
Thank you so much, Ann, for sharing that. It was a nice surprise added to our agenda at the last minute. So we are 8 minutes ahead of schedule. So nice job, everyone. We're going to slowly move towards our public comment section. And we're going to let Rachel take over.
Thanks, Gail. Before we start with the people in person in the various locations, for anyone who signed up to do public comment remotely, you will be getting an email in your inbox with the link to a Zoom meeting. When you click that link, you're going to be in a waiting room until it's your time to speak. So just giving that quick reminder so you can check your emails. Is there anyone in Buffalo that would like to give public comment?
No, there is not.
Okay. I don't think there's anyone in Syracuse, but I'll pause for a minute. Okay. And in New York City? Anyone that would like to give public comment?
Yeah.
Yes, Chris.
Bye, Chris.
Great. Christopher, you'll have about 3 minutes. We won't put a timer, but just roughly 3 minutes. And as a reminder, this is a public comment period where you can share your experiences, your opinions, any thoughts that you want to share, but the committee will not be responding to any questions. Thank you.
Good afternoon. I'm Christopher D. Grive, an advocate for disability for over 32 years. And yes, I'm still still young, Jack Finney's age. The one thing I do want to say is as I wear a lot of hats, and I want to say as we end the 2025, I wanted to thank the commissioner and all the OPWDD staff, because this year we got a lot of things accomplished with the helping out people with disabilities all over the city. And I'm only going to say the city and Long Island because it is attached to Brooklyn and Queens. That really did help. And when we did the 8835, we accomplished a lot. I just hope to see in the near future that we can continue advocating more out there. And I want to thank the presentation with the other Christopher, because advocate is the one word I've been saying since day one, because they need to hear from us. Advocates with disability, parents, veterans, all kinds. And I just hope in the future we can continue advocating and work together on this for the future of accessibility, because not everyone's going to be here, and we have to get fresh, I'm not going to say the bad word, I'm just going to say fresh bodies that way, so we can continue advocating. And I do want to hope that we continue doing much more and work together, because you know Albany is going to get the Metro North train coming up there. Yes, and I will see you up there soon, guys, coming up there. But I will remind everyone, please, let's continue advocating for everything, from transportation to our healthcare and everything. So all I want to say is Happy New Year to all. Thank you. This is Christopher D. Grive from New York City.
Thank you, Christopher. Is there anyone else in New York City that would like to give a public comment?
No, this is the, I'm just going to, last call. Go on.
I asked, they didn't want to.
No, New York City's done. Happy New Year.
Thank
you both.
Okay.
All right, we're going to then turn to virtual comment. There's no one in the room yet, so we're just going to give them a minute or two to check their email, look for the Zoom link, and make their way into the meeting room. And if you want to give a comment, but you're a little camera shy, there is an ability to click the participation tab at the top of the webinar where you can give a comment or a question in writing. We do download all of those, and they are sent to the team to look at after the meeting. So if you are interested in sharing but don't want to get on video this fine Wednesday afternoon, you can comment that way.
Rachel, are we done? Back
Yeah,
over to us?
no one. We do have some written comments, but no one in the waiting room to give a spoken comment.
Okay, so I guess that wraps up public comment. Before we end our meeting today, we do want to hand it over to Willow Bayer, our commissioner, for a quick announcement.
Sure. Before we do that, though, are we sure that were there people signed up for public comment? Do we want to make sure that the technology worked for them to get into the room?
They all got the email. We can give it another couple minutes, another 2 minutes. Okay.
If they haven't.
And if someone signed up and can't figure it out, maybe they can let us know in the chat that something's not working?
Yep.
Okay.
Yeah.
Great.
Thank you. I'm not even looking at the time. Following the agenda.
Daily Doubtful?
Daily Doubtful.
That's so good.
The guy that runs our FSS programs, some of them is
Super creative.
amazing.
Yeah.
He's so engaging and they love him because he's so funny.
That's awesome.
He dresses up as Bigfoot regularly. It's hilarious. Yeah. He oversees all of our lending libraries. He oversees our advocacy group. They just love him. He's fantastic. He was such a good hire.
So there is someone named Will who is in the meeting. If you would like to give a comment, you can go off mute and you have 3 minutes. If you're trying to speak, you are still on mute. Well, if you're trying to speak, you are still on mute.
Yeah, I think that's just Flo Malley. Alright, just checking to see if everyone was in the room.
Oh, okay, thanks. It was our Will.
He was testing out. Oh, okay.
We were like,
So that was fake, yeah, sorry.
It worked.
It does work, yeah. So we have no one else waiting to comment.
Okay.
Totally up to you if you want to wait. You're good?
Mayor, do you know if you had anybody? That they wouldn't.
All right, it sounds like folks that maybe had signed up changed their mind about public comment. So we'll wrap up. I'm really, again, just glad that I was able to join you. Looking forward to diving into some of the concerns that were raised. I was really happy to hear some of those success stories. We're doing really great work. I want to acknowledge for folks that don't know that this is Alexis Harrington's last statewide meeting because she has decided against my objection to leave the agency at the end of the year. I tried to veto it. Counsel told me I didn't have that sort of authority over people's lives. Alexis has been with the agency for about 6 years, and under her leadership, this meeting in particular, and the work under the council has been so productive. Alexis brings just so much energy and love and positivity to everything that she does, and she'll be really, really missed at the agency. She is staying around, and we will hear and see from her. But I wanted to just join Gail and Kathy in acknowledging that this was Alexis's last meeting with us and thanking her for all of her work with this team.
So Alexis did Alexis did keep this pretty close, but a little bird might have shared the information with Kathy and I. So on behalf of the statewide FSS Council, we just wanted to thank you for everything you've done, and for just being a great advocate, a good teacher, a good partner, for making sure that our voices were heard and that we understand a lot of the information being shared. You've really been a great translator, and it's been really great working with you, and we are going to miss you very much.
Yeah. I'm truly touched. Whew, I'm so glad I can't see myself right now. But I just, I sincerely want to thank you all from the bottom of my heart. I know that we all are like a family. You know, sometimes we fight and sometimes we always love each other. But I truly believe that we have been able to get so much accomplished at this table, and you will continue to do that, leaving you in the most capable, amazing, incredible hands with this team. And they're giving me way too much credit, I will say, but it has been such a pleasure getting to know each and every one of you over the years. I wish that I could give hugs to those who were not able to make it in person today, but just thank you from the bottom of my heart, and please don't be a stranger. You can find me on LinkedIn. I'll still be there, but I will be in the field still. So thank you, everybody.
Deborah, you have your hand up.
No, really, it's Mike Christopher, and we're all here crying, Alexis. We're gonna miss you. He's really gonna miss you. He's the one crying really the most. That's it, not me. I can't do that.
I'll be right there.
Thank you.
I'll meet you at Penn Station.
Sounds good.
Does anybody else have anything they'd like to say from virtual or Buffalo? I think Long Island's gone, Syracuse.
Well, thank you. I hope whoever replaces you has even half the amount of positivity that you have. But, you know, you really care about everyone and the people you work with. So,
Yeah,
it's going to be big shoes to fill.
Thank you.
He called me. I'm certainly going to miss you.
I am really
I'm going to miss you too.
I really enjoyed working with you and the team. Who's going to be in that spot where Alexis goes? To be determined?
Yes.
Tough
To be
shoes to
determined,
fill.
yes. But I know that the shoes will be filled because this team is incredible. There's some amazing people who work for OPWDD who care so incredibly much about the people that we support in this system.
So now do we have this copy of Biba?
What was that? I can't hear you, Kathy.
Oh, yeah, she let us copy everything to her and the team.
We'll set up a meeting just to talk about interim transition planning.
Sure.
Absolutely.
Thank you.
Of course.
Okay. So finally, in closing, I'd like to wish everyone a happy Hanukkah, Merry Christmas, Happy New Year, Happy Kwanzaa, and anything else I miss. But we wish you all a very happy holiday, and be aware that our next meeting is March 11th at 11 a.m. We'll be meeting, Gail and I will send out a note, a doodle poll. Oh, no.
We have
the
a standing meeting now.
Sorry, standing meeting, Thursday? Anyway, we'll get the standing meeting notice out for January. So
the future meetings, we just have the first one.
I have them all. You want me to tell you all?
Yes.
It's on the agenda.
Up there
Oh,
on the
here it
screen.
is.
Thank you so much.
And have a good, oh yeah, everyone drive home carefully. God knows what's going on out there. We'll be surprised. And thank you, everyone.
Thank you.
Take care now. Bye-bye.